The 2023 amendment to Malta's abortion law was passed in response to intense international pressure following a high-profile medical crisis involving an American tourist. The legislation, known as Bill 28, was introduced by the governing Labour Party to protect doctors from criminal prosecution when performing life-saving procedures. However, it was heavily watered down before passage due to immense pressure from Malta's deeply conservative, anti-abortion majority. The catalyst, the Andrea Prudente case. In June 2022, an American tourist named Andrea Prudente was on vacation in Malta when she suffered a life-threatening, incomplete miscarriage at 16 weeks pregnant. The medical crisis, her placenta detached and her amniotic fluid drained completely, meaning the pregnancy was entirely unviable. The legal deadlock, because the fetus still had a heartbeat, Maltese doctors refused to complete the miscarriage. Doing so would have violated Malta's absolute ban and carried up to 4 years in prison. The escalation, as Prudente faced a severe risk of sepsis and death, her travel insurance eventually flew her to Spain via a private medical air ambulance to receive a legal, life-saving termination. Prudente later sued the Maltese government, arguing that their total ban violated human rights. The case made global headlines and caused severe reputational damage to Malta's tourism-reliant economy. How the law was passed, the political compromise. The Maltese government originally introduced a bill to allow abortion if a woman's life or health was in grave jeopardy. What followed was a highly contentious national debate that ultimately forced the government to rewrite the law. Massive backlash. Tens of thousands of citizens protested on the streets, backed by the conservative opposition Nationalist Party and the influential Roman Catholic Church. A presidential ultimatum. Malta's president at the time, George Vella, privately threatened to resign rather than sign a law that liberalized abortion. The final U-turn. The ruling party stripped all broad health protections from the text. The version that passed Parliament in June 2023 restricted abortion access strictly to cases where the mother faces imminent death. The justification offered by officials. Maltese authorities justified the historic change through two primary legal and ethical arguments. Preventing double deaths. Health Minister Chris Fearn argued that the law was a logical mathematical necessity. He stated, "The choice isn't whether the mother or the baby survive. The choice here is whether the mother and baby both die, or whether the mother's life is saved." Legal immunity for doctors. Historically, Maltese doctors used an unwritten ethical concept called the principle of double effect, saving a mother's life knowing the fetus would die as a side effect. The government justified the amendment as a formal protection mechanism so doctors would no longer have to roll a high-risk dice with criminal courts while managing emergency rooms. The aftermath. While the government framed the law as a compassionate compromise, it ultimately pleased neither side. Pro-choice coalitions called the final law a betrayal, arguing that the requirement for 3 specialists to approve an abortion during a health crisis creates unworkable, fatal delays. Conversely, anti-abortion groups accepted it only because it kept Malta's near-total ban functionally intact. In Malta, the medical diagnosis of a fetal heartbeat functions as the legal threshold between standard medical care and a criminal offense. The clinical reality of tracking cardiac activity heavily intersects with legal definitions and medical ethics, fundamentally driving Malta's modern abortion conflicts. The diagnostic paradox. Life versus viability. Medical technology creates a distinct conflict between what an ultrasound detects and whether a pregnancy can realistically result in a live birth. The heartbeat detection, early in a pregnancy. Ultrasound technology detects rhythmic electrical impulses or gestational cardiac activity. In Maltese law, this signal is treated as definitive proof of a living fetus that possesses a full right to life. The danger of signal confusion. One of the greatest clinical challenges is maternal-fetal heart rate coincidence. A doctor may see or hear a rhythmic pulse on the monitor, but it can be highly difficult to determine who it belongs to. Maternal pulse echoes, major blood vessels pass directly behind the uterus. Ultrasound and Doppler machines often accidentally pick up the mother's own rapid heartbeat or uterine blood flow noises, mimicking a fetal signal. The danger of misdiagnosis. If a mother is in medical distress, her heart rate will spike, tachycardia. Her heart rate can climb to 110 to 130 beats per minute, which perfectly mimics the normal baseline range of a fetal heartbeat, 110 to 160 bpm. A doctor might mistakenly believe a dying fetus still has a heartbeat, when they are actually just tracking the mother's pulse. Legal and medical paralysis. Because Malta's criminal code historically penalized any action that terminates a living fetus, these technical ambiguities create a terrifying legal trap for physicians. Fear of gray zones. If an ultrasound shows an irregular, faint, or unquantifiable signal, a doctor cannot be 100% sure if the fetus is alive or dead. If they intervene to save a hemorrhaging mother while a faint signal is present, they risk being prosecuted for a felony. The necessity of M-mode imaging. International guidelines recommend that doctors only use visual M-mode imaging, which tracks movement over time without using high-energy sound waves, to confirm early heartbeats, rather than audio Doppler. Audio Doppler can heat up delicate fetal tissue. However, M-mode requires highly specialized equipment and flawless positioning, adding another layer of difficulty in an emergency room setting. The viability disconnect. In complex medical emergencies, a fetus can have a fully detectable heartbeat despite zero chance of survival. For instance, if a woman experiences previable preterm premature rupture of membranes, PPROM, where her water breaks completely at 15 weeks and the placenta detaches, the fetus cannot survive. However, the fetal heart may continue to beat for days or weeks. The clinical challenges. Because a heartbeat can persist in a dying pregnancy, doctors in Malta face severe operational and legal challenges. The threat of prosecution, as mentioned under the Maltese Criminal Code, Intentionally stopping a fetal heartbeat carries up to 4 years in prison for doctors, also permanent loss of their medical license and livelihood. Watchful waiting and torture in non-viable pregnancies. Doctors are legally forced into a practice of watchful waiting. Medical staff must perform daily ultrasounds strictly to see if the heart is still beating. Patients and physicians have described this as a form of psychological torture, as families must actively hope for the fetal heart to stop so that medical intervention can begin before severe infection sets in. Maternal health risks. Delaying delivery while a fetal heartbeat is present exposes the pregnant woman to extreme, life-threatening complications, primarily sepsis, a deadly blood infection, and catastrophic hemorrhaging. The influence on recent policy changes. This specific diagnostic dilemma is exactly what forced Malta to amend its laws in 2023. The catalyst was the 2022 case of Andrea Prudente, an American tourist, who suffered a complete placental detachment at 15 weeks, while vacationing in Malta. Maltese hospitals refused to terminate the non-viable pregnancy because a fetal heartbeat was still present. She had to be medically evacuated via an air ambulance to Spain to receive life-saving care. The international outrage and a subsequent judicial protest signed by 135 Maltese doctors spearheaded by Dr. Isabel Stabile, who argued the law prevented them from providing safe medical care, directly forced the government to introduce its first-ever statutory exception.